My name is Dr. Michael Curran. I'm a urologist at Greater Boston Urology. My primary site of practice is at our new Dedham location, and I do most of my operating and surgery procedures at Eastern Massachusetts Surgical Center. I decided to be a doctor early on, I think. I decided in high school that I wanted to be a physician, and that led me to be able to concentrate and focus my studies so that as I went through college and medical school, that I'd be prepared to get into medical school. In my free time, I like to play golf and I like to do skeet shooting. One of the things I wanted to talk about today was a condition called benign prostatic hypertrophy, or commonly referred to as BPH. This is a very common condition that affects men. It's typically seen in an aging population. BPH is an enlargement of the prostate gland. As men get older, the stromal tissue in the prostate, which is the connective tissue and support tissue of the gland, continue to grow, where the glandular tissue, which is the tissue that handles the reproductive qualities of the gland, usually does not continue to grow. As the stromal tissue grows, it has a concentration around the urethra and tends to restrict or impinge the flexibility, mobility, and size of the urethra. As this happens, men will notice varying degrees of difficulty with urination. In some men, it may present in a condition where they're in retention, meaning they don't empty their bladder of urine, and other men just present with flow issues, where the urinary flow is restricted and they may develop symptoms or signs of urgency. If you don't seek treatment for an enlarged prostate and are beginning to have bladder dysfunction, some of these changes could become permanent. So you don't want to kid yourself into thinking that this happens to everybody, there's nothing that can be done for it. If you seek the help of a urologist, there's actually a lot we can do for it. We can control symptoms with medications. We can also cure the problem with surgery. We are what we call an integrated urology practice, meaning that from the time a patient comes into our practice setting, literally our doors, we believe and strive to care for everything within the field of urology that that patient's going to need, which means many of the imaging studies that they need, a lot of the diagnostic testing that they need, the pathologic testing that they need, and the surgical treatments that they need, we try to manage within the walls of the company itself. So that makes us very unique.